Erinoak Kids Center for Treatment and Development Services for Autism. Erinoak is an amazing community resource that has a variety of services available for purchase. Erinoak offers resources for children and ongoing support for the parents, treating the family as a whole. They also assist in the filling out of the Ontario Autism Program budget form, helping to maximize the services available to you. Erinoak also offers clinical rehabilitation and treatment services such as speech, language therapy, occupational therapy, physiotherapy, and social work services. Erinoak Autism Services and Programs. Depending on the needs of the child, packages can include strengths and needs assessments, workshops for parents and caregivers on feeding, sleeping, toileting, and changing behaviors, parent and caregiver coaching, functional behavior assessments and follow-up plans. At Erinoak, children are taught essential skills such as communication, language, socialization, play, self-regulation, daily living skills, and management of challenging behavior. All programs are supported by licensed and qualified therapists, doctors, and social workers.
Erinoak has a special communication package for children under 6 years of age. It focuses on increasing their social and communicative behavior to improve their social relationships and access to a better social environment. Their initial needs and strength assessments are carefully done by trained speech and language pathologists. They also help with individual intervention and goal planning. Erinoak gives a better access to a social communication group for 8 2-hour sessions, as well as play group or respite bundle for about 2 hours. A speech language pathologist is always available to provide support and advice on various communicative systems. This program is for children up to 6 years of age with a diagnosis of autism. The service options, it's about $4,800. The duration is for 6 months approximately. And the location is at Brampton, Mississauga, or the Oakville sites. The contact information is you can call on the numbers provided. That is 905-855-2690. Here are a few links of the virtual tour of Erinoak Kids, which is located at the Halton region, and also two powerful and inspiring stories of two students who have enrolled in Erinoak Kids, and Erinoak Kids have helped transform their lives in a better way.
Erinoak Kids has a variety of services for children with ASD to help develop and improve their socialization functions. These services are categorized based on the age group and the needs of the children, and are available in all 3 locations of Erinoak Kids, in Brampton, Mississauga, and Oakville. There are 5 main programs to address autism services for socialization as follows.
Erinoak Kids Autism Services for Socialization, Kindergarten Readiness Group, ages 3 to 5. This program provides services such as opportunity to develop kindergarten readiness skills including play, self-regulation, social skills, support a successful transition to school, and identify goal areas. Also play activities and kindergarten type routines such as snack time and circle time. This program is conducted by clinicians coaching and modeling teaching strategies. Erinoak Kids Autism Services for Socialization, Social Communication Group, Level 1, ages 3 to 6 or 7 to 12. This program provides services such as positive interactions with play activities, understanding and expanding motivation, developing and increasing functional communication skills, parents' engagement with children during sessions, ABA strategies to build socially appropriate skills, starting to play beside one another, copy each other, take turns, tidy up after play, and encourage early cooperation, pretend play, rule following, And also they provide recommendations on building communication, social skills at home and in the community. Erinoak Kids Autism Services for Socialization, Social Communication Group Level 2, ages 3 to 6 or 7 to 12. This program provides services such as cooperative play, playing games with specific rules, negotiating conflicts with friends, becoming independent with play, and positive peer interaction, build on communication, group skills, participate in games, activities popular for age group at school and in the community. Strategies for families to foster children's social communication skills and making and keeping friends, participating in group activities in the community. Erinoak Kids Autism Services for Socialization. The next program is a stay and play groups, introducing to respite up to age 12. This is a stay and play group series for children to interact with peers, toys, and activities, self-regulate in the absence of a parent, and support and coaching with separating from a parent, and parents and caregivers to participate or leave children to have fun and explore Longo's Family Resource Center. And this program is only available from Monday to Friday. Erinoak Kids Autism Services for Socialization also conducts a sports and games group. This is for ages 7 to 12 years. And this program provides services such as increase familiarity with recreational sports, build social and life skills for day-to-day interactions with siblings, peers at school and during games. This has the curriculum of young athletes developed by the Games from Special Olympics Canada, and it also has sing-songs, play activities to develop motor, social and cognitive skills, and it has ABA strategies to follow to increase participation, build physical and social team skills, following group rules, taking directions from peers, learning to win and lose with good manners. And this program is for children who enjoy playing sports and doing physical exercise.
Erinoak Autism Services, Physiotherapy. Physiotherapy specializes in the prevention and alleviation of movement disorders of the arms, legs, and/or trunk, assisting children and youth to move and function within all environments. Physiotherapy services may involve assessment, treatment, and consultation, prescription of therapeutic equipment, therapeutic groups, teaching of functional exercises, and individual or group therapy combined with parent education and coaching. Physiotherapy may also include home programming and consultation to caregivers, professionals, and supportive personnel who interact with the child, as well as promotion of participation in sports and recreation activities both at Erinoak Kids and in the community, and promotion of movement, participation, and independence in the home, daycare, and community environments. Intervention focuses on skill development as well as on creating environments that promote optimal physical functioning. Intervention occurs with collaboration with the family and the whole service team. As of the summer of 2017, Erinoak Kids has expanded its pediatric physiotherapy clinic to include services for the following: ligament sprains, joint stiffness and pain, repetitive strain injury, rehabilitation after fracture, sports and recreation injuries, and more. These services are covered by OHIP with a referral from a doctor. Only children and youth up to the age of 19 are eligible for these services. Other referral criteria are that they must live in Peel, Halton, or Dufferin, and children who are currently receiving speech and language services, intensive behavioral intervention services, and/or applied behavioral analysis services through Erinoak's or an Erinoak's subcontractor may access OT services concurrent with their other services and needs. Referrals will be reviewed and services will be determined based on the child's individual needs and meeting eligibility requirements. So the referral process is health professionals, families, and clients can complete the referral form, Completion of the referral form is required to access this service. Visit the Intake Services page for the referral form and more details. There are different conditions that are typically seen at Erinoaks. A couple examples are cerebral palsy, spina bifida, skeletal disorders, neuromuscular disorders, metabolic mitochondrial disorders with neurological impairment, and more. Erinoak Autism Services. Occupational therapy. Occupational therapists provide services for children and youth to improve their ability to function and participate in everyday activities. Occupational therapy services may include assessment, treatment, and consultation, individual or group therapy combined with parent education and coaching, home programming and consultation to caregivers, professionals, and supportive personnel who interact with the children, and promotion of participation and functioning in the home and community environment. Occupational therapy may also include activities of daily living, such as motor development, self-help skills, and play skills. Also, recommendations for home modifications and vehicle modifications for wheelchair accessibility and effective functioning in all environments, support and training in use of adaptive equipment, and intervention that focuses on skill development as well as on creating environments that promote the best functioning. Intervention occurs with collaboration with the family and the whole service team. Occupational therapy has specific referral criteria, such as children need to be between the ages of 0 and 19, they must live in Peel, Halton, or Dufferin, children who are currently receiving speech or language services, intensive behavioral intervention services, or applied behavioral analysis services through Erinoak's Kids or an Erinoak's Kids subcontractor may access occupational therapy services. Referrals will be reviewed and services will be determined based on your child's individual needs. The occupational therapy referral process. Health professionals, families, and clients can complete the referral form. Completion of the referral form is required to access this service. Typical conditions seen by Erinoak Kids occupational therapists may be cerebral palsy, spina bifida, skeletal disorders, neuromuscular disorders, and more.
Erinoak Autism Services for Behavior. Current services available for behavior are ABA, preschool and kindergarten classroom, focused consultation services for children and youth, focused assessment and treatment of challenging behaviors, intensive behavioral intervention, child care before and after school program package, essential foundations, self-regulation, ages 6 to 12, which is new for the fall. They also offer help in choosing services that will best support your child. There is an orientation and family services planning session, which is free, and an early intervention information session, which is also free. Erinoak Autism Services for Behavior will help identify the challenging behavior and identify the antecedent, replace the behavior with stepping stone behavior, and eventually lead to desired behavior by setting long-term goals. Helping develop strong communication skills along the way to help manage behaviors. Helping improve individual behavior, using positive praise, or using consequences for behavior. They will help you choose a reinforcement. Behaviors happen for a reason. Identifying the causes of behaviors can help us change them. Behaviors can start for any of the following reasons. Serves to escape, I don't want to do this, attention seeking, sensory, tangible, and verbal stem. Behaviors will be monitored so data can be collected and a plan can be put into place using the best possible practices. In summary, as an educational support, knowing what resources are available in the community can change a way the family lives for the better. Families newly diagnosed with behavioral and physical exceptionalities will need help navigating the challenges they are facing. Knowing how to utilize community resources or navigating the healthcare system is so important. Parents of newly diagnosed children also need support. The success of the child stands a greater chance if the family is treated together, maximizing the services available to you.